Let's get started with Dr. Sanchez from Victoria, Australia.
Good morning, and thank you for the invitation to present our work on liver hereditary optic neuropathy, LHON, in Australia. LHON is a primary mitochondrial disease caused by a point mutation in mitochondrial DNA. There are three primary LHON mutations that are found in the vast majority of patients. The 11778 and 14484 mutations are by far the most common mutations, but there are also other rare mutations that have been associated with the disease. A LHON mutation is homoplasmic in most patients, meaning that the mutation is present in all the cells in the body. However, LHON mutations affect a specific cell type in the eye called retinal ganglion cell. Retinal ganglion cells are neurons in the back of the eye, in the retina, that transmit visual information to the brain via the optic nerve. Clinically, LHON presents as painless, sudden, and irreversible vision loss in one eye, and this is followed by vision loss in the second eye within a year in the vast majority of cases. Some patients may experience spontaneous recovery, and this is particularly the case for younger patients with the 14484 mutation in our experience. LHON typically affects young, healthy men in their late teens to their early 30s, but it can also present in older men, women, and young children. As a primary mitochondrial disease, LHON is passed on by the mother. So if the mother carries a LHON mutation, she will pass it on to all her children. If a father carries a LHON mutation, he won't pass it on to his children. Nevertheless, all LHON mutation carriers have a lifelong risk of developing vision loss, and some of them may indeed lose vision. Our recent work aimed to answer a question that we get often asked by people with LHON mutations. What is the risk of vision loss for someone with a LHON mutation? To answer this question, we first needed to update our database of LHON families in Australia. The last time we looked at this was almost 30 years ago in 1992. Back then, there were 20 independent LHON families in Australia, including 291 affected individuals and 1,750 asymptomatic carriers. So we conducted an epidemiological assessment of LHON in Australia to update the previous data available from the 90s. And in our 2020 update, we identified a total of 96 genetically unrelated LHON families. This includes 56 new families, and we updated 40 previously known pedigrees. Since records started in Australia, we found that 620 people have lost vision due to LHON, including 458 men and 156 women. Currently, there are 350 living individuals with vision loss due to LHON and almost 5,000 asymptomatic LHON mutation carriers. With these numbers, we were able to determine how common vision loss due to LHON is in Australia, also known as the minimum prevalence. We estimated that 1 in 68,000 Australians suffers from vision loss due to LHON. We were also able to determine that the vast majority of people with vision loss due to LHON carries one of the three primary LHON mutations, and the three primary LHON mutations account for 87% of total LHON cases in Australia. We confirmed previously known information that LHON causes vision loss predominantly amongst males, with almost 3 males affected for each affected female. We were able to determine the age at vision loss in about half of all affected patients to date, and found that individuals who carry a LHON mutation can convert from asymptomatic carriers to affected patients at any time during their life. Amongst males, vision loss peaked between the ages of 15 and 20. For females, however, the age at vision loss was distributed more evenly. Around 10% of both males and females lost vision at age 10 or younger, and almost 12% of women experience vision loss at age 50 or older. Current literature reports LHON as a young man's disease. However, females, older adults, and younger children are also at risk. So the main question we wanted to answer with this study is something we get asked often by patients and their families. What is the risk of vision loss for someone who carries a LHON mutation? A risk of 50% amongst males and 15% amongst females is commonly cited online by patient support groups. However, we wanted to see whether this was the case amongst Australian LHON families. We found that penetrance, or the percentage of people with vision loss amongst those who carry a mutation, is highly variable across individual families. Most families were relatively small and had 1 or 2 affected individuals, with a risk of vision loss of about 10%. But we also found examples of highly penetrant families with multiple affected individuals and a very high risk of blindness. On average, amongst the 96 Australian families, the overall risk of vision loss was 17% for males and 5% for females. This translates to an overall risk of vision loss for 1 in 6 males and 1 in 20 females who carry a LHON mutation. This risk is much lower than commonly cited, and it highlights that we should not blindly quote a 50% risk of vision loss amongst males who carry a LHON mutation. Our results are important for 2 main aspects: genetic counseling and the interpretation of clinical trial results. In terms of genetic counseling, we can now provide an updated risk of vision loss for individual families and for the general population of LHON mutation carriers in Australia. This will help us identify Australian families with a higher risk of vision loss that might benefit from clinical trials, genetic counseling, and even mitochondrial donation when it becomes available in Australia. In terms of clinical trials, it is critical to have an accurate estimation of vision loss risk, as a falsely overestimated risk may lead to an underpowered study or a false claim of efficacy. Finally, I would like to acknowledge the contribution of the key clinicians and researchers involved in this collaborative effort, in particular Professor David Mackey, as well as the LHON patient community and their families around Australia, and the Mito Foundation for supporting this work. Thank you.